In this video we will learn following aspects about thyroid gland, how the thyroid gland works, thyroid hormones, facts about T3 and T4, pathway of thyroid hormones release, diseases and disorders of thyroid gland, hyperthyroidism, hypothyroidism. The thyroid gland is a butterfly-shaped organ located in the base of your neck. It releases hormones that control metabolism, the way your body uses energy. Functions of thyroid gland. The thyroid's hormones regulate vital body functions, including breathing, heart rate, central and peripheral nervous systems, body weight, muscle strength, menstrual cycles, body temperature, cholesterol levels, as shown in the diagram as well. Location of thyroid gland. The thyroid gland is about 2 inches long and lies in front of your throat below the prominence of thyroid cartilage, sometimes called the Adam's apple, as shown in the diagram. Location of thyroid below Adam's apple. Structure of thyroid gland. The thyroid has 2 sides called lobes that lie on either side of your windpipe, and is usually connected by a strip of thyroid tissue known as an isthmus. Some people do not have an isthmus, and instead have 2 separate thyroid lobes. In this diagram, thyroid gland structure is explained in 2 ways, front view or back view. On front view, 2 lobes of thyroid gland, and on back view parathyroid glands are shown, which are attached on the thyroid gland. How the thyroid gland works. The thyroid is part of the endocrine system, which is made up of glands that produce, store, and release hormones into the bloodstream so the hormones can reach the body's cells. The thyroid gland uses iodine from the food you eat to make 2 main hormones, triiodothyronine, T3, thyroxine, T4. It is important that T3 and T4 levels are neither too high nor too low. 2 glands in the brain, the hypothalamus and the pituitary, communicate to maintain T3 and T4 balance. Thyroid hormones. Thyroid hormone made up of tyrosine derivative and iodine. Tyrosine is an amino acid, thyroid bound to carrier protein and formed thyroxine binding globulin. Facts about T3 and T4. T4 removes 1 iodine and become T3, deiodinase. T3 don't oxidized. Both have 2 phenyl ring. Both are not isomers. No phosphate in thyroid hormones. Difference between T3 and T4. Per day secretions of T3 is 30 microgram per day, and T4 is 80 microgram per day. Source of T3 is 20 to 25% by gland and 75 to 80% by conversion, and T4 source is solely by gland. Half-life of T3 is 1 day and T4 half-life is 7 day. Potency of T3 is 3 to 4 times more potent than T4. Binding of T3 is 0.2% in unbound and 0.02% in unbound. Pathway of thyroid hormones release. Hypothalamus releases thyroid-releasing hormone, TRH. TRH triggers anterior pituitary gland and releases thyroid-stimulating hormone, TSH. TSH acts on thyroid gland and releases T3 and T4. T3 and T4 act on liver. From liver, T3 act on other target tissues like liver, kidney, brain, heart and muscle, as shown in the diagram. Hypothalamus releases thyroid-releasing hormone, TRH. TRH triggers anterior pituitary gland and releases thyroid-stimulating hormone, TSH. TSH act on thyroid gland and releases T3 and T4. T3 and T4 act on liver. From liver, T3 act on other target tissues like liver, kidney, brain, heart and muscle. When T4 and T3 increases, negative feedback mechanism activates which act on pituitary gland and stops thyroid-stimulating hormone, TSH release. It is a major regulatory step. Why you need a thyroid gland. T3 and T4 travel in your bloodstream to reach almost every cell in the body. The hormones regulate the speed with which the cell's metabolism work. For example, T3 and T4 regulate your heart rate and how fast your intestines process food. So if T3 and T4 levels are low, your heart rate may be slower than normal, and you may have constipation weight gain. If T3 and T4 levels are high, you may have a rapid heart rate and diarrhea weight loss. Diseases and disorders of thyroid gland. There are many diseases and disorders associated with the thyroid. They can develop at any age and can result from a variety of causes: injury, disease, or dietary deficiency, for instance. But in most cases, they can be traced to the following problems: too much or too little thyroid hormone, hyperthyroidism and hypothyroidism, respectively, abnormal thyroid growth, nodules or lumps within the thyroid, thyroid cancer. Hyperthyroidism is the abnormal function of your thyroid gland, an organ located in the front of your neck that releases hormones to regulate your body's use of energy. In other words, if you have high thyroid levels, it means that your thyroid gland is overactive and makes more thyroid hormones than your body needs, which causes hyperthyroidism. Symptoms of hyperthyroidism are increased sensitivity to heat, sudden weight loss, frequent bowel movements, sweating, fine brittle hair, rapid pounding heart rate, nervousness and irritability, tremors, difficulty sleeping, and changes in menstrual patterns. Hyperthyroidism causes: Graves' disease, overactive thyroid nodules, thyroiditis, increased iodine consumption, increased thyroid hormone medicine intake. Graves' disease is defined as the most common cause of hyperthyroidism. Graves' disease is an autoimmune disorder that results in your body creating too much thyroid hormone. About 1% of the U.S. population is affected by it. Graves' disease symptoms are bulging eyes, goiter, enlarged thyroid, overactive thyroid nodules, lumps that grow on your thyroid gland and damp up thyroid hormone production, increased iodine consumption. Some foods and medications contain iodine, and too much can overstimulate your thyroid. Thyroiditis. This is inflammation of your thyroid, and it can arrive in 3 different ways: subacute, painful, enlarged thyroid, possibly from a virus or bacteria. Postpartum, occurs after a woman gives birth. Silent, painless, possibly enlarged thyroid, likely from an autoimmune condition. Higher risk for hyperthyroidism. You're at higher risk for hyperthyroidism if you have a family history of thyroid disease, have pernicious anemia, a vitamin B12 deficiency, have type 1 diabetes, have primary adrenal insufficiency, also known as Addison's disease, a disorder where your adrenal glands don't produce enough hormones, such as cortisol, consume an iodine-rich diet or medications containing iodine like amiodarone, are over the age of 60, were pregnant within the past 6 months, had thyroid surgery or a thyroid problem such as a goiter, also known as a swollen thyroid gland. Diagnosis for hyperthyroidism. Methods of diagnosis for hyperthyroidism include analysis of medical history and symptoms, physical examination, an ultrasound or nuclear medicine scan of your thyroid to see if it has nodules, or to determine whether it is inflamed or overactive, blood tests to measure levels of thyroid hormones, including thyroid-stimulating hormone TSH, thyroid hormone triiodothyronine, T3, thyroid hormone thyroxine, T4, thyroid peroxidase antibody TPO. Hyperthyroidism treatment. Antithyroid medications. These drugs interfere with the production of thyroid hormones. Methimazole, brand name Tapazole, is the most commonly prescribed hyperthyroidism medication, whereas propylthiouracil, also known as PTU, is preferred during the first trimester of pregnancy. Radioactive iodine (RI) therapy. This method damages the cells that make thyroid hormones. Surgery, also known as a thyroidectomy, the surgery to remove the thyroid, either one part or the entire gland, can be an effective treatment for hyperthyroidism. Serious complications of hyperthyroidism. Complications can include Graves' ophthalmopathy or thyroid eye disease, an eye condition causing double vision, light sensitivity, eye pain, and even vision loss, irregular heartbeat, thyroid storm, a life-threatening condition resulting from a major stress such as trauma, heart attack, or infection, pregnancy complications, high blood pressure during pregnancy, low birth weight, miscarriage, premature birth, thinning bones and osteoporosis. Hypothyroidism. Hypothyroidism is a condition in which the thyroid gland is not able to produce enough thyroid hormone. Since the main purpose of thyroid hormone is to run the body's metabolism, it is understandable that people with this condition will have symptoms associated with the slow metabolism. Hypothyroidism symptoms: intolerance to cold, receding hairline, facial and eyelid edema, dull blank expression, extreme fatigue, thick tongue, slow speech, anorexia, brittle nails and hair, menstrual disturbance, hair loss, apathy, lethargy, dry skin, coarse and scaly, muscle aches and weakness, and constipation. Late clinical manifestations: subnormal temperature, bradycardia, weight gain, thickened skin and cardiac complication. Hypothyroidism causes. The most common cause of thyroid gland failure is called autoimmune thyroiditis, also called Hashimoto's thyroiditis, a form of thyroid inflammation caused by the patient's own immune system. The second major cause is the broad category of medical treatments. The treatment of many thyroid conditions warrants surgical removal of a portion or all of the thyroid gland. If the total mass of thyroid-producing cells left within the body is not enough to meet the needs of the body, the patient will develop hypothyroidism. Following are the risk factors for hypothyroidism. I have a family history of thyroid disease. I have had my thyroid monitored in the past to watch for changes. I had a previous diagnosis of goiter or nodules. I currently have a goiter. I was treated for hypothyroidism in the past. I had postpartum thyroiditis in the past. I had temporary thyroiditis in the past. I have another autoimmune disease. I have had a baby in the past 9 months. Diagnosis of hypothyroidism: physical exam, medical history, TSH, free $, and TPO antibodies, MRI and ultrasound. Hypothyroidism treatment. Hypothyroidism is best treated by using levothyroxine Levoxyl, Synthroid. This synthetic version of the T4 hormone copies the action of the thyroid hormone your body would normally produce. The medication is designed to return adequate levels of thyroid hormone to your blood. Hypothyroidism complications: myxedema, coma, medical emergency, hypoventilation. Respiratory drive is decreased resulting in alveolar hypoventilation, mental sluggishness, drowsiness, lethargy progressing gradually or sudden to impairment of consciousness or coma, subnormal temperature, hypotension, decreased pulse, does not perfuse tissues. Learn terminologies with MJM.